Compared to 20 years ago, when you walk into a grocery store now, there is usually a gluten-free aisle and certainly tons of gluten-free products. And everybody seems to think that they need to be gluten-free. We look at a lot of that here at Innovative Health and Wellness Center, and the question really becomes is, do we need to be gluten-free, and what do we need to look for to determine if we're having a gluten problem? So where most people assume it's related back to GI symptoms, and it can be, it also can be related to things like brain fog, muscle aches and pains, and even skin conditions. So today I want to share with you a quick story about a patient who came to see me. He had rashes all over his upper back and his arms. Couldn't figure out what was going on, and had shared with me that he spent over $1,000 with different dermatologists in order to figure out what was causing the underlying symptom. Well, what was interesting is after taking a history, we discovered that there was the possibility that he was gluten insensitive and that the gluten could have actually been causing the skin condition. So we ran some tests. We took him off the gluten because he did test positive, and what was amazing was within weeks that skin condition was totally gone after having tried to treat it in different fashions. So what I want you to think about is it isn't just tummy issues and GI problems in which we need to take a look at gluten, but it can be other things such as skin problems as well. The other really cool thing is, you know what? He decided to challenge it after his skin was clear for a period of time, and he thought, oh, I'm feeling pretty good. Let's go ahead and just try a little gluten and see what happens. And you know what? Sure enough, love the fact that he cheated and did it, because the condition actually came back, which just proved how toxic that was for him in that particular environment of his body, causing that rash. And as soon as he pulled that back out, you know what? The condition went away. So before you spend $1,000, let's take a look, see if gluten could actually be your true condition.